Hi everybody, this is Dr. Wohler checking in for another installment of these Great Plains webinars. Tonight we're going to talk about something a little bit different, something that is gaining more and more popularity, if you will. Not that it's popular to have, but popularity even in the mainstream medical community. It certainly has been something that has been recognized for quite some time in the integrative world. But it also has some crossover and applicability for those of you listening in who either have a child on the spectrum or maybe a practitioner who works with kids on the spectrum, in that clearly a lot of these kids have intestinal imbalances. But this is not strictly a talk tonight on small intestinal bacterial overgrowth and autism. It's small intestinal bacterial overgrowth in general for a wide variety of individuals. But I think you'll find the information here interesting and compelling. So with that, let's go ahead and get started. And we'll go to the next slide, and away we go. So we're going to talk about what is small intestinal bacterial overgrowth. I sometimes mispronounce whether it's SIBO or SIBO or SIBO. I tend to naturally say SIBO. But anyway, small intestinal bacterial overgrowth. And then we're going to talk about that. What is dysbiosis? What are some symptoms of small intestinal bacterial overgrowth? What are the causes? What's called the pathophysiology, sort of what's the big deal, and what may be some things that are associated with it. Clearly there's an issue of what's called fermentation in the gut. This leads to a lot of the symptoms, but you get more problems than just fermentation. It's the inflammatory issues that occur, the damage of the mucosa, lining the intestinal tract is a big deal, and that leads to a lot of problems too. We'll talk about testing, specifically breath testing for this disorder, and then also talk about the organic acids test that Great Plains has, crossing that over into the comprehensive digestive stool analysis, particularly the organic acid test, in that some of the bacterial markers can indicate problems of bacterial imbalance. And there's one specific marker that I'm going to point out tonight, which is very important with respects to this disorder as well. We'll link up some other diseases and disorders, and then we'll finish up and talk about some treatment options. Okay, so what is small intestinal bacterial overgrowth? Well, basically, it is a condition where large numbers of normal, and this is what is important, normal bacteria that are normally in the digestive tract, primarily in the large intestine, find their way into the small intestine, and where they normally wouldn't reside. And that leads to a lot of problems. And really, it's important to understand that the digestive system is compartmentalized. And we've got the stomach, we have the small intestine, and we have the large intestine. And these things are separated, which I'll show you some of the anatomy here in a second. They're separated by these valves that allow certain things to pass through and certain things not to pass through, or basically not move backwards. But the problem with this disorder is that we're now getting normal bacteria in the large bowel moving back into the small intestine, taking up shop there in places where it normally isn't found. And that is the problem. So the large bowel and the small bowel actually have normal bacteria that's kind of unique to that specific location in the digestive tract. So what is the role of the small intestine? Well, one of the things it does is it neutralizes food, the acidic nature of that food coming from the stomach. We know that the stomach is producing large amounts of hydrochloric acid, and as that what's called chyme, it's that breakdown material that's moving from the stomach into the small intestine. The small intestine is there to kind of help neutralize that acid. Also, the small intestine plays a critical role in digestion because it has a direct connection right through what's called the biliary tree. It has a connection to the liver and the pancreas, and the pancreas is producing digestive enzymes. The liver is producing bile acids, and bile acids are necessary for the breakdown and absorption of fat-soluble vitamins, whereas the digestive enzymes of lipase and sucrase and these types of things help to break down the fats and the proteins in another way as well. And so we also get a lot of nutrient absorption from the small intestine, but it's also the production of bile, which helps to remove waste material from the intestinal tract as well. So if our small bowel is not functioning properly, we have the potential of creating and regenerating a lot of internal toxicity. Also, the small intestine is a major area of immune system function, particularly down in the last part of the small intestine called the ileum. If we look here, we have the ileum, which is the last part of the small intestine, the jejunum, which is that middle section, and the duodenum, which is the upper section, or what's called the proximal end, closest to the stomach, and we can see the stomach here. So the duodenum is that area closest to the pancreas, where the pancreas is outputting these enzymes as well as bicarbonate to help neutralize that acid food coming from the stomach. And then the jejunum is this large area of just an expanded region of nutrient absorption. We get some nutrient absorption in that proximal end of the duodenum, particularly a lot of glucose and sugars are absorbed there. But we have an expanded area of nutrient absorption from the jejunum. And then really the major seat of immunity in the small intestine is down in the ileum. And if you work at all, or if you have a child on the autism spectrum, you know that some of them have real problems with bowel inflammation. And what they have found is that in some of the kids who actually are diagnosed with inflammatory bowel disease, it's the ileum, it's the last part of the small intestine that is often quite inflamed. I mentioned before the intestinal tract is compartmentalized. So we have the stomach, which is where, the major entry point of food, where we release, large amounts of hydrochloric acid. And then that food stuff has to pass through this particular area here called the pyloric sphincter. And it moves through this area, and then it's dumped into the duodenum, that upper part of the small intestine. You can see that here. It's that proximal end of the small intestine near the stomach. And so that creates a valve that allows things to move down to the small intestine and prevents, or should prevent, things that are in the small intestine moving backwards into the stomach. On the other end, we've got the small intestine and the large intestine. And there's a valve there as well called the ileocecal valve. And that ileocecal valve is, again, it's similar to that pyloric sphincter. It's this little inlet here. It lets things pass from the small intestine into the large intestine, and then that large intestine moves it down, and eventually it's removed as stool. But if we have a dysfunction here, and let's say there's inflammation and this valve is not closing properly, you can get a backflow. Now you've got a backflow of large intestine fluid and bacteria that moves itself back into the small intestine. In fact, you can actually find the approximate region of your own ileocecal valve if you're to lay on your back and you find your right hip bone, and in between your right hip bone and your belly button, right in the center on the right side, is your ileocecal valve. And there's a lot of docs sometimes that will do a manipulation technique. A lot of chiropractors have been trained in this, osteopathic docs have been trained in this too, as a way to try to massage the ileocecal valve to help it open and close appropriately. And a lot of times that can be a diagnostic tool as well, where you palpate that particular area, and if it's tender, that is a good indication that there is some type of ileocecal valve inflammation. And so that can just be a clue that there's some ongoing digestive problems. Well, what about dysbiosis? I mean, what's the difference between small intestinal bacterial overgrowth and dysbiosis? Well, for many years, and I still use that terminology in my consults too, where we talk about a bacterial imbalance and sometimes a yeast imbalance in the digestive system as being dysbiosis. Another word for dysbiosis is dyssymbiosis, basically a dysfunction or an imbalance of the normal balance of the bacteria in the digestive system. And basically that's what this definition is getting at, is that there's some imbalance that is precipitating some normal change in the activity of the gut resulting in some type of health problem. Now you could certainly have dysbiosis that could occur in the large intestine. You can have dysbiosis that is triggered by yeast. So not all dysbiosis would specifically be small intestinal bacterial overgrowth, but certainly small intestinal bacterial overgrowth would fall in the category of dysbiosis. And what's the most common cause of this? Well, it's antibiotic use for most people, because it's the antibiotics that tend to disrupt the normal bacteria and create a situation of opportunistic bacteria and yeast. Opportunistic bacteria, for example, would be Clostridia bacteria. Well, what are some of the symptoms that you can think about with respects to this problem? Heartburn and reflux is one. So heartburn and reflux is not always just a stomach issue. It's a back pressure pushing on that pyloric valve, pushing up through the stomach and causing reflux that way. Abdominal pain and cramping would be another. Mixed bowel elimination patterns, that alternating constipation and loose stools. It doesn't have to be. There are people who have this problem who have just constipation. There's others who have just chronic loose stools. But certainly in many of them it's a mixed pattern. Nausea can be an indicator of that. And then various malabsorption problems, whether it's fat-soluble vitamins, B12, iron, these things would have to be tested for. And then sometimes unrelated things that you would think about related to the gut. Systemic complaints, skin disorders, headaches, joint and body pain, chronic fatigue certainly. And then, as you would expect, things like excessive gas production. Well, if we look at the intestinal tract, and again, remember these things are in compartments. What is in the stomach will pass to the small intestine, will eventually pass to the large intestine, but we shouldn't get a backflow. If we've got a bacterial overgrowth in the small intestine, much of that gas, the hydrogen gas and the methane gas, can be passed into the large intestine, and you can start to get intestinal distension. You can physically see this with your kids or even on yourself when you've got bacterial imbalance or you've got yeast imbalance. We'll many times do the same thing. So it's producing gas that is now moving in, downwards into these compartments, and particularly into the large intestine. However, when you're doing breath testing, you basically are picking up on methane and hydrogen gas that is being produced in the small intestine. And it's the fermentation process that is quite complex. And basically this is just a chart to show you that there are a wide variety of different gut bugs that produce different types of fermentation products. Acetates and alcohol and butyrate and acetone, etc. What's interesting is that there are a number of organisms that are used in the fermentation process. And for example, this propionobacterium is often used in the production of CO2 and propanoic acid with the fermentation product of cheese. Wine and beer, Saccharomyces is often used to help ferment alcohol and in the production of wine and beer. And you can imagine if you've got an overgrowth of different bacteria in the digestive tract, that you can also be producing these different types of fermentation byproducts. For example, we know that yeast can ferment different substances and produce gas. Matter of fact, one of the things that yeast produces is something called acetaldehyde. And acetaldehyde should be converted into acetic acid. But we've got in some people, there are enzyme deficiencies, if you will, that cause a problem in that conversion. And we can have a buildup of acetaldehyde, which can cause a lot of physical problems, physical pain, muscle pain, joint aches and pains, etc. but it's whether the yeast or the bacteria is also then just taking these food byproducts and creating gas. And essentially that's the major thing that's happening in small intestinal bacterial overgrowth, to the point where some people just get greatly distended, uncomfortable, a lot of pain, causing digestive problems, as we've mentioned before. And you can imagine if this was happening in your child as well. So what are some associated diseases and disorders of small intestinal bacterial overgrowth? Acne, anemia, certainly have seen it in autism. I wouldn't say that these are direct causes, but these are associated problems that may occur. And these things are all referenced, by the way. People with small intestinal bacterial overgrowth oftentimes have a lot of food sensitivities. Celiac disease shows up, chronic fatigue shows up, and a lot of times there could be problems with esophagitis and other inflammatory conditions in the digestive system as well. Gastrointestinal reflux, as we mentioned before, is a side issue of this condition. If things are real severe, you may have somebody who has, a liver disorder, low stomach acid production, Helicobacter pylori. And this actually brings up a good point. Should you, as a practitioner or as an individual looking to, either have yourself, your child, or someone else assessed for small intestinal bacterial overgrowth, just solely rely on a hydrogen breath test? And we'll talk about that here in a second. In my view, just doing a breath test to confirm that there is a bacterial overgrowth, although that's beneficial, in many cases, and what we have found, is that people are also harboring sometimes other infections, certainly parasitic infections, and sometimes Helicobacter pylori infections, the infection of the bacteria that tends to infect the stomach. And so I think it is worthwhile to search deeper for other potential problems, because this whole condition of bacterial overgrowth doesn't occur by itself. There's got to be something that triggers it. And there's a lot of things that can trigger it or be associated with it. Many people with small intestinal bacterial overgrowth can have an increased susceptibility to various autoimmune diseases. And one of the things that happens with autoimmune conditions is something called cross-reactivity. Matter of fact, if you want to get more information on the abstract references for these particular disorders, associated disorders, you can go to SIBO, S-I-B-O, info.com. But just a quick comment about cross-reactivity of the immune system. If we've got inflammation of the digestive tract and we have a breakdown of the mucosal barrier, and we're now developing leaky gut, there are proteins that are entering into the lymphatic system and then entryway into the blood system that gain access to systemic circulation. Those things can trigger an immune response. In susceptible individuals, that immune response can then also cross-react with other tissue in the body. If it's your thyroid, you can develop thyroiditis. If it's your joints, you can develop arthritis. If it's your brain, you can develop neurological reactions. If it's your skin or your muscles, you can develop autoimmune conditions in that respects. Well, many times it's the bacterial overgrowth too in the digestive tract where you can start to get either bacterial toxins or bacteria themselves that trigger that cross-reactivity effect. And it has to do, with the overall function and the compartmentalization of our gut, but also something called the enterohepatic circulation. And enterohepatic circulation is once we gain entry into the large intestine, okay, once we've passed through the ileocecal valve and we've gained entry into the large intestine, what should happen is that water is reabsorbed from the large intestine through something called the portal venous system. And that is then taken up into the liver, recirculated through the liver, and if it is a toxin, many times it should be dumped right back down into the biliary system, back down to the small intestine for eventual elimination. But you're always going to get a proportion of it that can then regain entry into the blood system. And this is a potential route of what's called autointoxication, where people are recirculating bowel toxicity that not only can just cause inflammation and not to feel well, but this can also be a potential entry point for things that trigger immune reactions as well. So this is a big area that is often looked at in the world of integrative medicine, is how to improve bowel function and keep things moving in that downward fashion, from the stomach to the small intestine to the large intestine and out of the body, to get rid of those toxins. One of the things that leads to a backlog or a backup pressure effect for many people, and I see it quite a bit with kids on the spectrum, is constipation. If you get a backup of stool, it puts back pressure on the whole system, and that is a potential source of autointoxication effects through this enterohepatic circulation system. All right, but let's talk again now about small intestinal bacterial overgrowth and what are some known triggers for it. And I mentioned before that antibiotics can certainly be a trigger for it, but you can also have, other organisms that trigger a dysfunction, and where you tend to get, regionalized inflammation or regionalized problems. And if it occurs around that ileocecal valve, you now know if that ileocecal valve is dysfunctional, you've got normal bacteria moving from the large intestine back into the small intestine. And so certain toxins get produced. Those toxins will create inflammation and irritability in the gut and just create, a worsening overall situation with respect to what's happening in the anatomy and the physiology in those areas. And as you're starting to get normal bacteria moving into the small intestine, it's migrating into certain areas where it normally wouldn't be. And now it's there to help ferment food, because the bacteria, what they do is they create these fermentation products off of the different carbohydrates that we eat. There are other pathogens as well that can trigger this effect at the ileocecal valve or throughout the small intestine that can be a potential trigger for small intestinal bacterial overgrowth. One of them that is important to understand is Giardia, the parasite Giardia, and certainly other more enteropathic bacteria, Salmonella, Shigella, and even certain viruses. And we've seen people who've had this condition triggered because they had some kind of viral gastroenteritis effect that started to impact the way the peristaltic activity was functioning in the small intestine. It created inflammation around the ileocecal valve, and then over time it just set up shop for a backflow of normal bacteria. And so there's a lot of pathogens that can be that can lead to this, and so the whole goal here is what can we do to try to reduce the problem. Let me just recap real quick what we've talked about, okay? And that is we've got to think of the digestive system again in compartments. And there are trillions of bacteria, not millions, but trillions of bacteria in the digestive tract, with a large percent of those being in the large intestine. And when they overgrow and find their way into the small intestine, that's where we start to have problems. Anything that disrupts that peristaltic activity or the function of the sphincter areas can be a problem. What can disrupt the pyloric sphincter between the stomach and the small intestine? Well, one thing is the Helicobacter pylori infections can do it. So that bacterial infection can disrupt it. What about the ileocecal valve? Well, all of these other pathogens, which we've talked about and are going to talk about. Certain diseases, you can have intestinal neuropathy. This could be a side effect of long-standing diabetes, where you get dysfunction within the nerve pathways. That could certainly cause it. Sluggish peristalsis, we see that a lot in people who have chronic stress, a lot of sympathetic activity. They're not getting good parasympathetic activity into the bowel, and that causes peristalsis to be disrupted. Food allergies, gluten intolerance, et cetera, you kind of get the point, okay? So, and then we're talking about things that just try to improve, from the treatment effect once this particular disorder has been diagnosed. Well, let's talk a little bit about some parasites that will come up, and I've seen them, fairly often on stool testing, and the two that I'm going to talk about are things as if there's practitioners listening, you'll see most commonly. The most common parasite of what we're going to talk about here that occurs about 7 to 9% of all stool tests that are submitted to hospital labs for detection is Giardia. Giardia is a nasty parasite. You get it from contaminated water, and it can cause widespread damage throughout the intestinal system. Usually what you'll find is Giardia cysts on a stool test like we're seeing here. And it has a, this kind of an interesting life cycle and how it's passed. Highly infectious within a family setting. I've even had people who've been contaminated from pets. Their pets ended up having the Giardia infection that was causing reinfection for them. So we know that Giardia can cause maldigestion, malabsorption, and malnutrition, basically affecting fatty acid absorption. It can disrupt carbohydrate and amino acid metabolism or digestion, and mineral imbalances too. You can get Giardia that infiltrates itself up into the gallbladder area, so it can cause pancreatic as well as liver problems. The cystic Giardia can live under your fingernails upwards of 6 months. So it's a highly infectious parasite. If somebody in the house has it, other people should at least be tested for it, if not treated, along with the individual who has it. And the incubation of these cysts, could be anywhere between a week to 3 weeks period of time. What Giardia can do, either chronically or acutely, is cause what's called villus atrophy. It's those little finger-like projections along the small intestine that causes those things to break down. We get a breakdown of what's called the brush border, and that is what greatly affects our ability to absorb our nutrients. So Giardia is something that needs to be looked at. It's basically picked up off of a stool test, either through direct ova and parasite detection or what's called antigen staining, where they fluoresce the stool sample with different staining techniques to see if they can pick up on the cell wall fragments or the flagella, these little tail-like structures of Giardia. Cryptosporidium is another type of common parasite, not really as common as Giardia is, but I tend to see Cryptosporidium fairly often as well. Cryptosporidium is one of those things that can also be picked up through contaminated water. It's one of those parasites that's often been discussed when there's outbreaks in daycare centers. In people who are severely immune compromised, Cryptosporidium can be a real problem. In most people we find Cryptosporidium on, they have just some light stool problems, maybe some mixed constipation or diarrhea, some bloating or gas, nothing that would be real specific to crypto. It's generally picked up off of a stool test because we needed to look because somebody was at least symptomatic. The thing about the treatment for these parasites is that they're relatively easy to treat. Giardia, a little bit more easier to treat than Cryptosporidium in my experience. Flagyl, or what's called metronidazole, is actually quite effective against Giardia. Matter of fact, there's a protocol I'll show you here for using Flagyl for small intestinal bacterial overgrowth. There's another antibiotic called Alinea, which we've used with good success, and this is actually released here in the U.S. Alinea is specifically for acute Giardia and Cryptosporidium infections. It does come as an oral suspension for kids. The tablets are for adults, and whether it's a child or an adult, you're dosing it. The dose is given twice a day for 3 days. Now, in some cases with Cryptosporidium, I've treated for longer because it tends to be a little bit more difficult to treat than Giardia, but both are actually fairly responsive to antibiotic treatment. Okay. Well, what about some additional assessments for the digestive system beyond just parasitic infections? Well, clearly looking at comprehensive digestive stool analysis for bacterial imbalance. And again, we're picking up on bacteria that are sort of compartmentalized in different areas. The comprehensive digestive stool analysis that Great Plains has will break it down between what's called beneficial flora, so that gives you an idea of the good bacteria. But remember, you can have good bacteria in the wrong place. These tests won't show that per se, but they'll give you an idea of the levels. And then we've got opportunistic, or I should say commensal bacteria, which would be something like E. coli or Citrobacter or Proteus species, depending on the level it's at. And then dysbiotic, which would mean potentially problematic. So something here where we see the Citrobacter, the Klebsiella, all at 4+, indicating that the levels are quite high, certainly indicates that there's more of a dysbiosis type of situation occurring. Now, in this particular scenario, that doesn't necessarily mean someone has small intestine bacterial overgrowth. Okay, that would have to be confirmed off of breath testing. But it certainly gives an indication that we've got some bacterial imbalance in the digestive system. And then with all of these tests, if you do find opportunistic bacteria, you can do a bacterial sensitivity where they can figure out what antibiotic agent or what natural herbal agent is effective at eradicating that bacteria. And the same thing exists with yeast cultures too. We know that digestive problems in the pancreas can be a potential problem that may be something that triggers small intestinal bacterial overgrowth. This particular slide is looking at something called elastase. Elastase is a marker of pancreatic function, and when the level is low, it indicates that the pancreas is not performing efficiently in producing the enzymes that are needed to help digest our food. And if you've got normal bacteria in abundance in the small intestine where it normally shouldn't be, and your pancreas is not outputting a good amount of digestive enzymes, you're leaving a lot of undigested carbohydrates behind for those normal bacteria in the digestive tract to start chewing on and start metabolizing. And they're going to start creating a lot of gas and a lot of symptoms. Inflammation in the gut certainly can be another trigger for small intestinal bacterial overgrowth. This particular one is looking at Lysozyme, which is more of a surface level inflammatory marker. You oftentimes see the lysozymes high when there is dysbiosis of bacteria, sometimes yeast, and oftentimes when there's very high levels of food IgG reactions on food testing. And then lactoferrin, which is more specific for inflammatory bowel disease, where the lactoferrin, I think, is more of a deep-seated marker, a more deep-seated inflammation. At this particular level on this test, I've seen this level coincide with food sensitivities or bacterial overgrowth. It's not always confirmatory of inflammatory bowel disease, but it certainly pushes you more in that direction, if you will. And then we've just got, dysbiosis associated with whether it's elevated lysozyme or elevated lactoferrin. So the comprehensive digestive stool analysis can be a worthwhile thing to do if you've got a lot of ongoing digestive problems to rule out or rule in parasitic infections and get an idea of digestive function from inflammation, pancreatic output function as well. But when you're talking about small intestinal bacterial overgrowth and you want an absolute confirmation as best as possible, because these tests as well aren't 100% effective all the time, meaning that there is still the potential that somebody could have small intestinal bacterial overgrowth and not be producing enough hydrogen or methane that would register really high in the test. Most of the time it does. I mean, the rates are pretty high. You might be talking, 4 to 5% of the people that doesn't happen. But again, this certainly gets you close, and this is going to be more specific for getting that diagnosis or detecting true small intestinal bacterial overgrowth. This is just an example of a test from Commonwealth Labs where they are measuring hydrogen production and methane production. Hydrogen gas and methane gas in the digestive system are from bacterial fermentation. So that's coming from the small intestine. That is being produced from abnormal bacterial fermentation of carbohydrates. And what happens is that the way the directives are for these tests is there is breath samples that are taken at certain intervals after doing a preparatory diet for a day or two prior, and then taking a substrate packet that could be either lactulose, which is a sugar that that our bodies don't have the ability to process, but the bacteria in the small intestine can, or glucose, which we normally can metabolize, but certainly it's a substrate for the bacteria in the small intestine. And so then you're taking breath samples about every 20 minutes or so over a 3-hour period of time, and that's where they're measuring, if we go back, hydrogen and methane production to see if it is in excess. In this particular one, the levels were okay. Well, what about the organic acid test? If you've heard many of my presentations, you know I'm a big fan of this. I'm traveling the country doing one-day seminars on organic acid testing. I think it's an incredible, useful test for any practitioner to do in their practice. And we certainly know that the organic acid test is very important for the detection of yeast byproducts. But is there anything in the organic acid test that might give us a hint for small intestinal bacterial overgrowth? Well, it turns out there is. This is just a sample of that first page of the organic acid test, if you've done this on yourself, a patient, or your child, where you're looking at arabinose levels specific to yeast, and then sometimes various bacterial markers. I often will talk about 17 and 18, specifically HP, HPA, and for creosol being specific for Clostridia bacteria. Well, it turns out, and what Great Plains actually has done as of this past March, is they kind of retooled the organic acid test and shifted some of the markers into some different categories. This specific marker here, number 15 listed now in the test, 4-hydroxy phenylacetic acid. It turns out that that marker is produced by different Clostridia bacteria, and it also is an indicator of dysbiosis in the digestive system, as are some of these other hydroxys, the 2-hydroxy phenylacetic, the 4-hydroxy benzoic, the 4-hydroxy hyperic. Those can all be indicators of dysbiosis. So in this particular case, we've not only got Clostridia difficile that's high at number 18, but we see 10, 11, 12, and 14 also high. Well, it turns out that there is an interesting research article that came back out in the 70s in the Journal of Clinical Chemistry that was correlating 4-hydroxy phenylacetic acid as a screening test for small bowel disease. Essentially, see if my thing will move here. What would be defined as small intestine bacterial overgrowth, as they're discussing here. Okay, so they're talking here about small bowel disease and bacterial overgrowth syndromes in 300 unselected acutely ill infants and children versus controls. What was interesting about this is they also found in a certain percentage of these patients that this particular marker was also evidenced with individuals who had Giardia, parasitic infections, like I talked about prior. So again, it can be one reason that you not only just want to do the organic acid test, which I feel is incredibly important, but at some point also do stool testing to see if there is any kind of chronic parasitic infection as well, particularly something like Giardia. And this is just a pretty typical sample of an organic acid test, that first page of the organic acid test, looking at a child here who has major dysbiosis. We got a very high Clostridia marker. We've got a very high 4-hydroxyphenylacetic acid and a number of other markers that certainly indicate or point towards bacterial imbalances and Clostridia problems. Well, let's talk a little bit about treatment options, because clearly we've got to do something to reduce the bacterial problem in the gut and then try and create a scenario where we can heal the gut as best as possible. A lot of the research into antibiotic therapy for this disorder is with the use of something called rifaximin. And rifaximin has been useful in a number of situations because it has very poor absorption from the digestive system, which is a benefit because the drug actually stays in the gut. It doesn't get absorbed systemically and move throughout the body. Also, antibiotic resistance to rifaximin does not occur, one of the other benefits of this particular medication, and it can have an anti-inflammatory effect in the gut too. This thing's not moving, hold on. A typical dosing schedule for rifaximin, this would be for adults, 550 milligrams, 3 times daily for 14 days. Now, in my experience and the way things are moving, unfortunately, with our medical system, this medication is not as easy to get as we would hope, and it can be quite expensive if insurance doesn't pay for it. But it is something quite effective for small intestinal bacterial overgrowth from an antibiotic standpoint. It actually is considered the best solo antibiotic for bacterial overgrowth when only the hydrogen levels show up high on a hydrogen breath test. So if you do a hydrogen breath test and only the hydrogen levels show up high, this is your guy. If not, if you've got a mixed pattern, hydrogen or methane, then oftentimes using a combination of rifaximin and either neomycin, okay, at 500 milligrams twice daily for 14 days, or Flagyl, 250 milligrams 3 times a day for 14 days, can be useful. Now, if you ended up doing a stool test as well and found out you had some kind of parasite, you might be able to kill 2 birds with 1 stone with something like the Flagyl. If there's Clostridia bacteria that has been either detected off a stool test or has been detected off of the organic acid test, either from the elevation of the HP-HPA or the fruit 4 creosol, then something like Flagyl may not be a bad choice either. Okay, so the Flagyl, I think, is going to have a little bit more cross-sensitivity to other things, but the rifaximin is really specific if the hydrogen is high, and either neomycin or Flagyl if that methane gas is high. And by the way, Flagyl is pretty cheap and inexpensive and readily available. Well, what about the diet? Okay, what about the role of diet? Well, as you can imagine, it certainly plays a role. If we've got a lot of carbohydrate consumption, we're going to have the potential for any normal bacteria that has found its way into the digestive system to use it as a fuel source and ferment the products or byproducts of it. So all of the diets, that are related to small intestinal bacterial overgrowth are really there to try to reduce the potential food sources for intestinal fermentation and to reduce those carbohydrates. It turns out that there are a number of fermentable carbohydrates that tend to really create problems for people. So a lot of the starchy foods, beans, seeds, legumes, grains, fruits, sweeteners, these can all be things that are easy for this overgrowth of normal bacteria in the small intestine to ferment. So most of the diets that are related to this are really involved in reducing consumption of those foods. This book on the right, The New IBS Solution, Mark, I think his name is pronounced Pimentel, MD, he actually has done quite a bit of work and research into small intestinal bacterial overgrowth. I don't have a slide on this, but there was one particular study where they were looking at individuals with irritable bowel. So a lot of people have been walking around with a diagnosis of irritable bowel syndrome who actually turn out to have small intestinal bacterial overgrowth, and this is some things that he's talked about. So this book was really about the new irritable bowel syndrome solution. Well, basically, it's taking that dietary approach realizing that for most irritable bowel, it's really a small intestinal bacterial overgrowth situation that hasn't been, quote unquote, diagnosed that way. But the dietary program is relatively the same. The FODMAP diet is another popular diet with this. And from the world of inflammatory bowel disease and really the world of autism, the specific carbohydrate diet is often used quite a bit in the world of small intestinal bacterial overgrowth. And this is probably why a lot of kids on the spectrum who don't have true inflammatory bowel disease get better when they do the SCD diet. It's probably because what's happened is they're cutting off the starch, they're cutting off a lot of these starchy foods, and they're no longer feeding the bacteria in the small intestine. Because I've seen plenty of kids who don't really fit the criteria for, autistic enterocolitis who just do extremely well with the specific carbohydrate diet. They probably have small intestinal bacterial overgrowth. They've just never had a methane breath test done before. So if you want to get more information on the diets, by the way, go to siboinfo.com. People often ask, well, what are some things that can be expected by doing these dietary treatments? It's possible that you may normalize or at least greatly improve the bacterial overgrowth in the small intestine just by diet. But again, and we're talking probably more adults here than kids because it's been around a lot longer for most adults. It's going to take time. It's going to, it's not a quick fix. In some cases, 1.5 to 3 years or more may be needed if you're not doing other things in conjunction with it. So it's often advocated, to do dietary intervention first, kind of, cut off the supply of these carbohydrates 2 or 3 weeks prior, and then move into your more active treatments, whether it is the antibiotic treatment, herbal antibiotics, or other types of remedies. Normally, in the perfect scenario, if you cut off the inflammatory foods, if you've decreased the bacterial overgrowth in the gut, and decreased things significantly, the digestive system has an incredible ability to regenerate itself, short of somebody with inflammatory bowel disease, okay? But we normally should be able to regenerate and see marked improvement. Sometimes if you hit the mark and are doing things and things are rocking and rolling the way they should, sometimes within a month, usually a couple months, it takes for things to start to really turn around, depending on how long standing these problems have been there. But it's certainly with dietary intervention, whether it's antibiotic treatment or herbal treatment, there should be marked improvement, I'd say on average within a couple months for most people. One of the remedies that we can talk about that we might consider an herbal antibiotic, but it's certainly a useful herbal remedy, is biocidin. And biocidin is a combination of a number of different, plant substances, herbal substances, grapefruit seed extract, garlic, black walnut, etc. And the nice thing about biocidin is it comes as a liquid extract, which is really great for kids. It also comes in capsules, small capsules, so they're not difficult to swallow, even for somebody who doesn't has a difficult time swallowing capsules. I like biocidin. I've actually used biocidin in some protocols for Clostridia bacteria with good success. It's also very effective against yeast too. And I'm liking, the effects of biocidin for many different types of things. And I've even had a few cases of a parasite called Blastocystis hominis be cleared with biocidin. But bacterial overgrowth, yeast overgrowth, biocidin certainly has its place. And if we're talking about, again, most adults, 1 to 3 capsules, 2 to 3 times per day, for about 4 weeks in a more general standpoint for small intestinal bacterial overgrowth. You could always add in some garlic extract. And matter of fact, there's been some studies that have been done where garlic is effective, probably a little bit more so when the methane levels are high on a breath test. But again, it's innocuous to use. It's not harmful to use. You could add in some garlic extract. A particular product that New Beginnings carries is the ELISA. Again, 1 to 3 capsules, 2 to 3 times a day for 4 weeks. Oregano oil also has usefulness against intestinal bacteria, also yeast as well. So it's one of these things where you as an individual or practitioner sometimes just have to kind of tailor your own program. But these are sort of just some general suggestions. I oftentimes will find a lot of people get additional benefit by using sometimes additional grapefruit seed extract. I think grapefruit seed extract is probably one of the better natural remedies for yeast. Clearly, I use it a lot with the kids on the spectrum, particularly this Nutribiotic brand, because it's a liquid, it's easy to dose. You can do 1 drop and work your drops up or work down without having to take a capsule or cut a capsule or try to figure it out that way. The one thing about the grapefruit seed extract is it is very strong tasting. So if you're using it in a child, you're going to need to mix it in some dilute citrus juice. It definitely has a strong kick to it. So it's all based on taste tolerance. I'm usually between 5 to 15 drops 3 to 4 times a day when I use grapefruit seed extract. If it's in a small child, I may only get to 3 drops. Usually on average, 8 to 10 drops 3 times a day tends to be at the taste tolerance level for most children. If there is a suspicion, and this would be more appropriate for adults or kids who can swallow capsules, where there's very poor protein digestion, maybe there's been documented Helicobacter pylori infection in the past, the use of betaine hydrochloride and pepsin, can be very helpful. Certainly useful for older individuals. I take a product similar to this when I remember, but it really helps my digestive system as well. As I've gotten older, I've noticed, I don't take a lot of it, but it definitely helps. So the one thing about it, because it has hydrochloric acid, you want to be careful to not use this in kids who cannot swallow, and you, as an adult, absolutely do not want to chew it because of the hydrochloric acid effect on the teeth. Sometimes parents, will also use digestive enzymes like Zyme-Prime. Houston Enzymes is a nice company. They make a number of different digestive enzymes. This particular one called Zyme-Prime is very useful for protein digestion and also can help with carbohydrate and fat digestion as well. And then the other one is more peptizide. Peptizide is really more specific for the breakdown of gluten and casein that is often used for kids on the spectrum. One of the things that my partner has done for many, many years, she's a naturopathic doctor, and has worked with patients where you have the scenario where people have just a myriad of different types of digestive problems, joint aches and pains, they're not sleeping well, they have headaches, and you can't really pinpoint one specific thing, but there's just a whole bunch of little things that mount into this individual who just doesn't feel well. They haven't felt well for years. And what she'll often do is just a general detoxification program, okay? Because really when you can try and clear the digestive system, get the liver functioning more appropriately, a lot of times you can help clear up the symptom picture. Because as she mentioned, it's difficult in some cases to figure out with people whether it's a lifestyle issue, a diet issue, an elimination problem, a combination of all that, or some underlying true medical problem. And not everybody, unfortunately, can do the breath test. It's difficult maybe sometimes even to do in kids. And so sometimes just doing a general detox program, can be helpful. One of the things that she has used is, again, stepping back to biobotanical research and the use of biocidin. Biocidin is very effective against various pathogens in the digestive system, but biobotanical research actually has a really nice comprehensive cleansing program. And matter of fact, you can go to their website, biocidin.com, go under the product section, look under comprehensive cleansing program. It'll take you to this section. And you can download a PDF form that gives you dosage recommendations for how to implement these different remedies, because you're not only helping to decrease bacterial and yeast overgrowth with the biocidin and something called Olivarex, but you're also now helping to bind up some of the toxins that get produced through the die-off effect of that. So this is something that has been quite helpful for people who just have a general struggle with kind of ongoing digestive issues where nothing has really been shown up. There's no parasitic infections, there's no documented bacterial issues. Maybe they've got some yeast, maybe they've got some bacterial markers that show up off an organic acid test, and perhaps you've got individuals who don't want to take antibiotics, can't tolerate antibiotics, can't get antibiotics. So something like the comprehensive cleansing program sometimes can just help clear the picture. This could certainly be done with kids too. It's just that, you know, the fact that a lot of these herbal remedies, they don't always taste well or taste, you know, good. If kids can't swallow capsules, you know, all of this stuff can be modified in my experience for children. It's just sometimes more difficult to do. So that really is more on a case-by-case basis where I would need to work with somebody individually. Well, what about some things, let's say you've gone through, whether you've used Rifaximin, whether you've used Flagyl, maybe you've used neomycin, if you've done a breath test where you found the hydrogen and methane gas elevated, maybe you've done a cleansing program using the biobotanical products, you've done oregano oil, you've done biocidin, you've done grapefruit seed extract, and you've got good either results with yourself, with your patient. Where do you go from there? Okay, you're doing the diet, you're trying to reduce, you know, the carbohydrates that, you know, create the problem of fermentation. What about long term? Well, depending on how long this problem has been going on will certainly depend on how long for most people need to do a diet. Could be years for some people. But there are some things to think about that can help to regenerate and heal the digestive system as best we can, okay? And primarily what we're trying to deal with is sort of improve what's called this brush border, these little finger-like projections here that help to move things along in the digestive tract. They're also there to help in these cells here to absorb the nutrients that we need. There are some things that can overall help with overall, you know, digestive immunity, decrease inflammation, and healing of the digestive system. Colostrum is a nice product. Colostrum has a lot of immune-regulating chemicals in it. Lactose-free colostrum is worthwhile, particularly if you're suspicious of anybody who has a dairy sensitivity. There are colostrum products. Some of them may have a slight amount of casein in it, so if you have a casein-sensitive child, you need to be careful that way. But for the general patient, these tend to work pretty well. L-glutamine is an amino acid that is known to help in the healing of the digestive system. Curcumin, matter of fact, the glutamine and the curcumin are things that can be purchased from New Beginnings, nutritionals if you've used them. N-acetylcysteine is something else to help regenerate glutathione. Also has a healing effect on the digestive system. I caution you, though, if you've not done testing or there is a problem of chronic yeast as well, I personally would probably stay away from the N-acetylcysteine because it can be a stimulant in some cases, particularly the kids on the spectrum with respect to yeast. So these are just some general ideas. There is a nice product that I like. It's a combination product from another company I use called Support Mucosa. This is available at biomatrix1.com. And I've actually used this with some kids as well. But it's a combination. You can look at what's involved in this product. A lot of adults take this. It's just, it was specifically developed to help improve and heal an inflamed gut, a gut that's been damaged, a gut that's been irritated, for a wide variety of reasons. So how long to take these things for is really up for interpretation. I don't have a specific protocol for any one person. It's, sometimes these things you just take them for, as long as you continue to get benefit. 1 to 3 capsules twice daily. It could certainly be taken more. In most cases, though, for adults, you're looking anywhere between 2 to 3 capsules, a couple times a day for 3 to 6 months. If it's real severe, maybe 2 to 3 months if less severe. But Support Mucosa is a nice product. Matter of fact, if you are a practitioner, listen to this. Probably the easiest thing to do is to use something like a combination product here versus trying to go out and take 5 other types of supplements to just heal the gut. So anyway, this is a product I like a lot. All right, so that finishes the information on small intestinal bacterial overgrowth. I hope that was useful for you. If you are interested in some of this testing, we actually have the test that I talked about, the organic acid test, the comprehensive digestive stool analysis, and even the small intestinal bacterial overgrowth breath test available at labtestplus.com. So you go to labtestplus.com and you can look at the complete list of labs that are available. And what happens is when you order through that site, when the results come back, there'll be personalized written interpretation that is done on that test that is then sent back to you. And that is either done for myself or my partner, depending on what kind of test we're talking about. The oat test, the stool test, the hydrogen breath test, I tend to do most of those myself. Also, if you have questions about you've got a certain situation that may be occurring with yourself, family member, your child, you're not quite sure which test might fit, what might be best, is there a combination test to do, you can go to the site and you can go under the which test section and just submit your question. And we will try our best to answer that for you. So labtestplus.com. Also, if you are a parent or a caregiver of a child on the spectrum, you know that you can reach me through this membership website here at autismactionplan.com. If you want to brainstorm some ideas about the potential for small intestinal bacterial overgrowth in your child, if you're suspicious about it, you've got tests to confirm it, what are some options? Great place to reach me. I'm on this website every day, on the weekends, on holidays, and I interact with people all over the world who access me through this particular site. And then finally, I want to let you know I'm about to release a major announcement about an autism treatment course that has been in the works now for a number of years. And we're going to be making a statement release about this up here in the next week as this course goes live. It's not live yet, but it's in the works. So if you are an individual who is interested in working more with kids on the spectrum, or if you are a parent who is wanting to get more in-depth information that is clinical-based, because this course is actually developed for healthcare practitioners, stay tuned, okay? Because this announcement is going to be made here within the next week as we move forward in launching this course, which is something I am very, very excited about. And then, of course, if you want to interact with me on a personal, a private level as far as consulting with you on your particular circumstance, or maybe it's your child, you can always set up a consultation with me through my practice. And the phone number is 951-461-4800. Email at info@mysunrisecenter.com. And I do health consultations for people all over the country and all over the world. So I can try to assist you in the best way that possible with lab interpretation and protocol development, etc. If you submitted questions tonight, those questions will come to me within a few days of this webinar as Great Plains catalogs those and they send those to me on email. I will answer those for you in every single one of those that's posted through here. So with that, everybody, I hope this information was useful for you. We will see you next time through the Great Plains webinars. And everybody have a good evening. Thanks so much.